Well, viewers, welcome to the show. We have got some really informative information for you about how the Democrats are screwing over the rural areas in the state of Michigan. There's no surprise. I've been dealing with this ever since I got elected back in 2015. The Democrats have always screwed over the rural areas. They think they're ignorant, clinging to their guns and religion, as Obama said. That's the attitude of the Democrats. So it's a constant battle to make sure that these people are getting at least the bare minimum for survival. Oftentimes they're not. The urban areas get so well taken care of anyway, and then particularly when the Democrats are in control. So the most recent situations happened under the big, beautiful bill. There was a lot of money set aside for rural healthcare, rural hospitals. We've got $173 million that was allocated to Michigan. And for those of you, especially in the rural areas, you have absolutely horrendous healthcare. The studies I've seen is rural communities get the worst healthcare in the nation. So you would think that this money would actually be going to them, but there's a secret, slippery plan that the Democrats have come up with to not assist these rural hospitals and rural healthcare, but to move it over into the Democrat-controlled areas. So there's been studies that show that it takes hours in a rural area, oftentimes, to get to have a baby, to get to a hospital. That's not the case in Oakland County, where I'm from, Washtenaw, Wayne, Macomb. There is a ton of specialties everywhere. It probably is going to take you average of an hour or half hour in most cases to get to a specialist. But in the rural areas, they have almost nothing. I was reading that I think there's one psychiatrist in all of the UP, and our special guest here, Representative Jennifer Wortz, is going to talk about how little there is in her rural areas. But the master sneaky plan that the Democrats have worked up is to count some little tiny portion of an urban county like Wayne, which is one of the most urbanized, count some little tiny portion, less than a township, as being rural, and thus the whole county qualifies as rural. So the same dollars can keep pouring into these Democrat areas and not taking care of the healthcare needs of the rural communities. So with that, I want to welcome our special guest, Representative Jennifer Wortz. Jennifer, tell us a little bit about, from your perspective, what this bill means.
Yeah, well, thank you so much, Senator, for having me. As far as I'm concerned, this bill means that, again, rural communities like mine are getting shafted, and we're getting sold out to special interests, organizations, or entities. I think you framed it well, that are probably have or will be making deals with the leadership in the Democrat Party and MDHHS. Hertel, who's been highly liberal in her agenda while she's been the director there. And the proposal that was put forth by rural hospitals, there was a task force created at the end of last year. The CEO of my hospital in Hillsdale County chaired that task force, and they presented all of the recommendations that this money could be best used to help 73 rural hospitals in the state, and they ignored it. They didn't submit any of their recommendations, and instead they took and they submitted a proposal. Our understanding it's a proposal that they've used before, even though we are in the top 10 states for rural population areas. We got awarded in the bottom 10 of funds that we got back in Michigan because that grant or the proposal was so poorly written, we feel like. If you look at our neighboring state of Ohio, they're getting $202 million. We're getting awarded $173 million. Iowa is getting $209 million. So not only did they not put forth a good proposal to the federal government, and we're suffering with less money coming back to the state of Michigan because of that, but then, like you said, they took a county of Wayne County that has over 1 million people, and because one little section showed a population density of 100 people or less, they labeled it partially rural, so that county and those hospitals in that community can get the same access to those funds that hospitals in my district, combined of 2 counties that's about 90,000 people, has to apply for as well.
Yeah, it's interesting what you just outlined, that Iowa, I think, has about 4 million people. I know Ohio has about 8 million. We are 10 million people. So they get 210 million. We get 173 million because of their sloppy work. And then even after their sloppy work and our state gets a diminished amount of money that we should be receiving from the feds, the Democrats have such a harsh feeling towards the people in the rural areas. For instance, I put in a bill to create a suicide prevention committee. And in the committee, one of the things we learned is 70% of all suicides are committed by men in rural districts between the age of 45 and 65. Now, that qualifies for about 5% of the population. So 5% of the population is committing 70% of all the suicides. And so Carroll, Michigan is where the biggest psychological center was in Michigan, or at least in the rural area. And the governor's proposal was to move the whole thing to Washtenaw. So where the people are actually the biggest need, where they're committing tremendous disproportionate suicides, she wants to move it there. And now we're same thing here. What are these people going to do if they do not get quality health care, from medical care, psychological care? As I think I mentioned, there's one psychologist in all of the UP. They just simply do not care about these people because, they're thinking, well, they're not our voting base. Well, I would care about the health care of people in the inner city and wherever if they had horrific outcomes and due to lack of us spending money there.
Well, you're getting right to the heart of the issue, and you may not even know this, but I actually had a brother that committed suicide. And that was one of the frustrations that we found in that process, is that to get him access to a psychiatrist was over an hour's drive. Inpatient care, also 2 hours drive away for in-depth patient care with little to no support that came out of that afterwards. The rural American is the highest, and actually the rural farmer even is the highest rate of suicide in our country, higher than even veterans, who I think are second. Not just mental health care needs that we're lacking, but then the other big issue is access to labor and delivery units. In my district, the hospital that I had all 4 of my children in, Coldwater Hospital, no longer offers labor and delivery. They closed their OB unit a couple of years ago because it's one of the most expensive units to maintain and operate. And they could not get OB doctor to come and keep that sustainable. And so if you live in the southern part of Branch County and you are, for example, on Medicaid, it could take you an hour to get to a hospital to have a baby. I don't think that's the problem in Wayne County or Oakland County, who are labeled qualifying as semi-rural counties. Comparatively, the access and resources to mental health care in those areas is enormously higher, accessibility-wise, than what you encounter in rural communities. And so I think the unfortunate frustration that I feel like we experience time and time again in rural communities is that you have people that sit up here in offices in Lansing, whether it's bureaucrats or even people in higher up roles within departments or legislators, that make decisions and have never stepped foot or lived in rural America to understand the challenges that we face. And obviously, in my community in southern Michigan, we still have more access than what our northern Michigan neighbors have. You go north of Mount Pleasant, Clare, and the access, other than some of the larger, Traverse City, maybe Marquette and the UP, you're hours, as you said, to get to the services that you need. And that's just unacceptable. And we have to do better. And I think the part that makes me the most furious of all is that they took out $17 million of the money we are getting, which, as I said, is far lesser than our other states by comparison. They're taking $19 million and they're shoving that into the department to create 12 new positions with salaries of $170,000. So if you divided that out and you took that money and actually used it for the 73 rural hospitals, you're also robbing them of $260 $100,000+ that they should be getting instead of it going to administration and new jobs here in Lansing.
Yeah, it's outrageous. And to me, it's diabolical. It's despicable. It's a situation where I really believe the majority of the Democrat politicians think of people in rural areas as a bunch of ignorant people that do not need to be considered. That's the feeling I have. And this is demonstrable of that. The fact that you have almost no services in the rural areas where they have to drive hours. I read a Detroit News article that said they had to drive, in some cases, 5 hours to have a baby. 5 hours when you're in labor in the urban areas, it's not more than 40 minutes. Anywhere you go in the urban areas out where I live, I mean, there is specialties, there is hospitals, everything under the sun, but you get up in the middle of the rural areas and there is absolutely nothing. And on top of that, I have been another big bugaboo with me has been that when they pay for the education of doctors and nurses and psychiatrists, they bring them in these residency programs. They say, listen, if you go to an underserved area, we're going to pay off your student loan. Oh, sounds great, except how they define underserved area. They define it as low income, Medicaid. So they go right to the same exact area, we have a ton of Medicaid in Oakland County, Macomb County, Wayne County, all these have tons of Medicaid. So they're working in the same population in the same area, going to the fine restaurants and the plays where they would do it anyway and getting paid. And I have been screaming about this since I got elected. Let's define underserved as underserved, meaning that there's nobody there to help them. Then not only are you now going to be able to solve some of that problem, but what happens is a lot of these people are going to start falling in love with that. They live there for a few years, they go, this is beautiful, and they end up staying. But since I've been there, I could never get the system to make the change. So we're paying all of these medical bills for no end because they'd be there anyway. What we need to do is say, go to where the real need is, and that you define that by the population and the number of healthcare professionals. If you did that, we'd be pushing all these people out into the rural areas to get them surface. But that has never been a priority, and this is even worse what they're doing here, denying these rural areas because they want to redefine Wayne County with all the resources they have there is now in a rural area to suck up those funds.
Well, and even beyond, just add to that, I mean, the huge need I've heard as well is dentists and physical therapists. So they changed the rules for physical therapists that you now have to get a doctorate degree. And so what had been a 2-year program is now a 4-year program. So these young people are coming out with that much more debt. And part of the deterrent as well is that if you go to a larger location, then you have better hours. You don't have to be the person that is, on call or 24/7. Not only are you going to get reimbursed your school expenses, but you're also going to have more free time, essentially. And so it just is another deterrent to get people willing to move to rural communities because it's more work, less money, and you have a huge amount of debt. And so if I'm a young person, I analyze that. It's like, well, yeah, if I can go to a urban area and I'm going to get this reimbursement and I get paid a little bit more and maybe my cost of living's a little bit more, but I'm going to have more free time. I can work 40 hours versus 60 hours in a rural area. I don't blame people for not choosing to come to rural communities, but it continues to be another just kind of, chip against us. And then where there could have been some of these funds used to incentivize, as you're saying, to bring young people back to rural communities. I mean, I think if you come and you live in a rural community, you realize actually there's a lot of benefits to it, and you quickly are willing to sacrifice some of those conveniences for the community and the people and just those closer relationships. And so a lot of people will come to our, Hillsdale, for example, come and they end up deciding to stay and raise a family there. But if there's no incentive to ever come in this situation, then they're probably not going to come, and it's going to continue. I mean, the projections are that this is only going to get worse for us. I've talked to several people that are highly concerned about dental care moving forward. You know, we again may be driving hours to get to see a dentist, or you're going to wait 6 months to a year to get in for services. And neurological is another thing. I had an issue last fall, actually, here at the Capitol, and my wait to get in to see a neurologist was months. It's a big issue.
So it's really outrageous that the system is incentivizing people to stay where they're at in these urban areas with all the resources and all the redundancy of healthcare. And that's where we're paying them to stay where they would. It's a waste of taxpayer dollars because they stay there anyway. When the real use should be whether it's this fund for these rural hospitals, whether it is paying the student loans of dentists, of neurologists, of OBs, of all of these psychologists, all of these should be incentivized to go where the need is. Ever since I was there, and I talked to healthcare policy when I was back in the House, and I said, can't we change this? I don't even have a rural area. I'm in Oakland County. I mean, you can maybe somewhat define it as rural, some very small pockets of Oakland County. We have access to everything. But I care about these people. I care that they can't have a baby. I care that they're committing suicide. They have no resources. I care that they don't have dental work. I care. It's not my area, but I care. I hope that the House and the Senate Republicans, and even the Democrats who maybe do care, even if it's not in their area, can get together and work to solve the devastating loss of any kind of realistic health care for these people that are in desperate need, like a third world country, in our country, when we're incentivizing right now the same systems that already have redundancy, already have resources, and absolutely screwing over these rural areas. So would love to work with you in the Senate and you in the House to hopefully really make some changes this year to correct a lot of that.
Well, yeah, thank you so much, Senator. I appreciate that. And also, I will add that I sent a message last week to the federal department and raised this concern as well, that, you know, this money that you intended for us to be able to use in rural communities and rural hospitals to offset the costs that occurred from the One Big Beautiful Bill are instead just being grabbed and going to be used by essentially Democrats to benefit their big donors is really what I think it comes down to. Big hospitals and big entities that give them money are going to benefit on the backside through these funds, and us in rural communities are going to get none of that money because, as you said, they don't care about us because we don't support their ideology or their platform. And so this was a way for them to take and rob these funds and misappropriate them to places that they were never intended to get. And I think our congressmen need to be made aware of that. And we need to be sounding the alarm at the federal level that you need to understand that these funds that you thought were going to be helping rural hospitals are not helping rural hospitals. They're not helping to level out that disadvantagedness that we're having in rural communities. And that is a disservice to not just those of us that live there, but it's a disservice and really, frankly, an insult to that you think we're that stupid.
Well, thank you, Representative Wortz. You make a compelling case for what needs to be done. I didn't even think about reaching out to our federal congressmen and senators. You would think that if they have a heart, if they have compassion, they would look at this absolute wrong being done to these devastatingly impoverished people in rural areas who have nothing and care and want to correct this. So I'll do the same thing. I'll reach out to them from my office as well. We'll work together on this, and hopefully we'll get it changed. But I thank you so much for your care and your compassion for the people in your district and across the state of Michigan. And thank you again for being on the program.
Thank you. Thanks for having me.